hypertension, this is very common, shock, and also CHF, or also known as congestive heart failure. You're going to hear about these throughout your career, whether you go into nursing or medical school, and you hear about this all the time as well. A lot of people die because of this every day. And if you look at some of the most commonly prescribed drugs at pharmacies, those drugs that people go get on a daily, on a weekly, are used to control these kind of situations. So why is this such a big deal? So your heart, as we have all established and know, is the pump that allows you to move the blood around the body. There are certain values that are important, especially when you talk about blood pressure. A healthy range is what they call 120 over 80, which is systolic 120 over diastolic pressure of 80. The term systolic just means this is the height of the pressure when the cardiovascular system squeezes and then the blood is hitting the aorta, right? So the moment the blood leaves the left ventricles, you're going to generate the highest pressure, and that pressure is hitting your aorta, right? So you're trying to measure how much force is actually getting to come out of the heart and move the blood to the body. Then the diastolic pressure, which is the lower number, is the amount of pressure that you get after the ventricles relax, right? So you're only really caring about the ventricles. You don't really care what's happening in the atria because it's so small and short of a distance between the traveling from the atria to the ventricles and ventricles to the lungs versus the ventricles to the body. So you're only really wanting to know how well is the left side of the heart performing. And one of the conditions, I'm sure everybody, if you're living in this year, 2021, if you lived in the past 10 years, you have heard about this silent killer, also known as hypertension. So hypertension is divided into 3 stages. We have the elevated stage where it's starting to climb up, and then we have stage 1 and stage 2. And these are all based on the specific values you get. So that's why, monitoring your blood pressure, monitoring your blood levels, your blood volume levels, monitoring your fluid intake, monitoring your sodium intake, those can all affect this. So a kind of range to give you started is that, and these numbers, I don't think you need to memorize these for the exam, but if you're going into nursing and you're going to pharmacy, you're going into medical school, these numbers will be like the back of your hand. It's like literally be your phone number. You need to know them. So 120 over 80 is a pretty standard. This is denoted by the American Heart Association. Now this is the golden standard. No drug therapy needed. That means you're healthy. They've been trying to push this number down to about 110 over 70. That's even better. So the lower, I wouldn't say too low where you don't have a pulse and don't have pressure, that's bad, but a little bit lower side would be a better value because that means you're not straining your heart. The muscles of your heart are not contracting and you're not generating so much strain. And that can also cause what they call a cardiac remodeling, where the heart can reform and then become larger. So pre-hypertension is described as 120 to 129, so about 10 points above 120, and then usually somewhere about less than 80 millimeters of mercury for the diastolic. Usually you don't have to do anything. That means maybe you can change your lifestyle, change your diet a little bit, start exercising, you should be good. Then once you get into stage 1, if you go into the hospital and then they always get your pulses read and then your vitals checked when you get in, and you have 130 over 139-ish over 80 to 89, you're probably going to be in stage 1, right? And if it's consistent, that means you probably are having hypertension, you're overweight, you're taking some kinds of foods, you're maybe straining your body. And then stage 2 is considered 148 over, and then I think 160 and plus is considered crisis, where you have to go to the ER, and that means you have to be innervated by drugs. All right, so that's your scale. And the American Heart Association has made some changes over these years, because if you start at a lower set point, you might be healthier. So hypertension is classified as primary or secondary. Primary just means that it is a cause of some sort of a result of these different physiological processes that are not working together, and the true root is hard to pinpoint. Secondary hypertension is a little bit more common, and this is oftentimes because of the fact that as you age and get older, other organs tend to get problematic, and then you're going to have some issues, usually with your liver or kidney, that causes that hypertension. So elderly folks usually will see this. When they say 5% of all hypertension, that's including all ages, but when you talk about the people that tend to get this, you're usually looking at elderly, right? So the elderly folks, when your body's water intake changes, your heart also weakens a little bit, then you have secondary hypertension. And this is some of the main causes. This is really cool. So the pathophysiology behind this is that there are some organ systems that are directly linked to it. One that you can relate to is endocrine. Whenever you have an excess amount of catecholamines or too much adrenaline, too much aldosterone as a result of tumors on the adrenal gland or tumors on the kidneys, they can also cause an elevated amount of hormones, which could then over time cause a higher output of the blood and strain your heart. Okay, that's something that we don't think about all the time, but when you have cancers of the adrenal gland or even tumors on the kidney, that can happen. Another one that is directly related is kidney function. So whenever you have kidney disease or renal artery disease, that will cause you to have a less ability to urinate. So you're less getting rid of fluid, and it stays stored in your body, so you have too much water, and therefore you have a hypertension. And then some other ones could also be linked to heart problems. For example, if you have a heart blockage. So because you're having a heart block, like we talked about last week, and you're skipping heartbeats, then your heart is not able to move the blood appropriately to get it to the kidneys and then get it out of the body. And then some other ones can also be impacts to your nervous system, right? So if you have some kind of lesion in your vasomotor system, in the medulla oblongata or your pons, that can also affect the rhythm of your heart's contraction, and therefore your heart isn't working on the same time frame. So altogether, what happens is that there are some causes that are very difficult to determine, but some of the guidances here is that when you have too much sodium intake and then you have a weakened kidney ability, then you have a chance for hypertension. When you have an increased sympathetic nervous activity, so let's say you're constantly on stimulants and you're taking tons of caffeine and you're constantly scared and you're constantly in a sympathetic mode, you can also cause hypertension. Right? That's why when you get angry, right? If you get this very burst of rage, let's say you're driving and you get road rage, right? Everybody has a little bit of that depending on how the time goes and what conditions are met. But if you let your emotions get to you, that can also generate an increase in heart rate, therefore chances of hypertension. And of course, you can also get this if there's resistance. And this is a concept that we didn't talk about today, but this is important because when you talk about blood flow in the body, you have to consider how well the blood is able to go from A to B. Anytime you have resistance, whether it be narrowing of the blood vessel or thickening of the arterial end lining, then you can cause the slowing down of the blood flow, right? And some other bad case scenarios could be you have plaque buildup, you have cholesterol deposit or calcium buildup, and that causes the vessel to be thinner and then more rigid so that the blood can't move as freely, right? So those are all very bad situations to be in, and that could lead to more resistance. The total peripheral resistance just means it's the total amount of resistance in the blood vessels. And as you become overweight, as calcium begins to thicken the arteries, then you can develop other conditions like arteriosclerosis, where the vessels are thickening and becoming more rigid. So those are all some of the causes that you want to avoid, but they're all linked together. And obviously, what is the immediate danger, right? So this is what they call silent killer, which means over the course of time, right, you're just living your life thinking you're okay, but the blood pressure is building up. You then damage the organs because the amount of blood flow hitting them. And as a result, you can also get the smaller vessels in your brain, the cerebral vessels, the basilar vessels, and then there's a set of vessels which I talk about in my recorded lecture, and I'll show you this after we go over this topic. The basilar artery, and then the circular willis, the base vessels in your brain are very small and thin. And the vertebral artery and then the basilar artery are very thin, where if the blood pressure goes really high, and then one of those tiny little blood vessels, arteries are damaged, then you can burst open that vessel and cause a stroke, right? So you hear about strokes frequently, right, in the elderly. It happens. And it's because of hypertension left unchecked. Another issue is when you have ventricular overload. So if your ventricles are overworking, let's say you are a bodybuilder, and then you go from like 180 pounds to 300 pounds in a short amount of time, right? And your heart needs to compensate for how much muscle and tissues and cells that need blood nutrients, then your heart also has to overwork. And that can then lead to abnormal hypertrophy of the heart, where the heart is remodeling into bigger shape. And then that can cause changes to your rhythm and hence arrhythmias. And in worst case scenarios, that's why cardiac arrest. So if you ever heard about, recently there's been a lot of news and stories about bodybuilders, and we're talking about non-natural, so people that take steroids and drugs, non-natural bodybuilders that are dying, right? Because they either abuse certain drugs or they get too big and use too much steroids and their body changes too quickly for any physiology to adapt. And then the last one, which we talked briefly about, is atherosclerosis or arteriosclerosis. This is just thickening of the vessel due to plaque or calcium deposits. Okay, so all of these things are very bad. And so what are some treatments, right? So you're obviously wanting to know, and there are a lot of drugs. As a matter of fact, these are probably the most commonly prescribed drugs all day, every day. And these are also used in non-intervention cases. So some people use this to lose weight. Some people use this to draw out water. And going back to that example in non-natural bodybuilding, some athletes, if you had to cut weight, you could take this. Like if you're a boxer and you had to make weight to be able to fight your opponent to make money, you could take some of these drugs to drop water rate and then be very, very, very dangerous, pushing your health into like almost compromise, but you could drop water rate quickly. So the first one is just your lifestyle. That's why exercising is good, limiting smoking, changing your diet. The second one is going to be a set of drugs that are potassium-based supplements. So usually with calcium, that can help. So when you take more potassium, you are allowing so when you absorb more potassium, you have to excrete more sodium. So by removing more sodium, you're losing more water. The other ones are a class of drugs called diuretics, right? Furosemide, and these are drugs that basically allow you to literally block off the receptors and the uptake of water in your kidneys, so you pee more. And then we also have beta blockers, which control the rhythm of the heart, right? And then we also have ACE inhibitors, this is the cool one. This is the enzyme. ACE is the angiotensin converting enzyme, which converts angiotensin 1 to angiotensin 2. The family of this angiotensin 2 is exactly the same thing that COVID-19, the SARS-CoV-2 virus, attacks. And what angiotensin 2 does is that this will eventually make something called aldosterone, right? This is that hormone you guys should know. It's on the exam for the lecture. And aldosterone is a lipid-based hormone which regulates the amount of water uptake. And so if you are able to block the enzyme, you're able to block A2, you're able to block aldosterone. So theoretically, you're just basically blocking aldosterone. And then the end goal here is that you're able to then not retain as much water and hopefully urinate and get rid of the blood volume. Another condition you might be able to relate to and you might hear about is preeclampsia. This is where you have this what they call toxemia of the pregnancy, and it occurs fairly, I wouldn't say it's super common, but you probably have heard of somebody that's gone through this, about 9 to 10%. And this is when you have this hypertension onset in a pregnant female beyond the 20th week of pregnancy. And the only cure for this is actually just getting the baby out. Okay, so there is no, I don't know the root cause. I think there's some research on what it might be, but there is no definite point of why the female pregnancy can cause elevation. I know somebody that has this and they get super hypertensive like crazy whenever they get into that stage of delivery and they have multiple kids. And some of the other symptoms include thrombocytopenia and also proteinuria, where you detect a lot more protein in your urine. And this can also lead to swelling. So going back to a little bit of the lymphatic system, and I know we're not going over this, but this is the topic of today, is that lymphatic system is important for drainage of the fluid. And when your lymphatic system gets clogged up, or if it doesn't able to allow the fluid to bypass, then you have a situation called edema. Right? So the lymphatic system works closely with the vessels because your blood vessels is where blood is going. But whenever you have excess fluid and lipids that you don't want in your body, you dump that into the lymphatic system to drain it out, right? So you're able to have like a sewage to dump the fluid out. And if you don't have the ability to do that, then all the fluid gets trapped in your blood vessels. So then it leads to edema, which is going to be swelling in your feet and your legs and hands. And you can, I think I might have a picture in here, but if you go to Google and just type in myxedema or edema of preeclampsia, you'll see how the legs swell up, and you might even see patients in the hospital walking in, limping because of this. And the cause, like I said, of preeclampsia is not well understood. There's some kind of link with possibly a misfunction, non-functional stem placenta, or even something with obesity, but I don't know the direct cause. And then as a result of this, if you don't let this get checked, the worst case scenario is that the mom could get a stroke, right? So you could risk a stroke and then causing them to not be able to ever, be a mom again. And what happens is that there are cases where, a mother goes through labor, right, goes through delivery, they have preeclampsia, and then they have a stroke, and that's why the mom doesn't make it, right? That can happen too. So that's why delivery and labor is still a very big process, right? It's not guaranteed. And with all the interventions and all the drugs and all the testing, right, we're able to know what's going on. But in some countries where they are limited on resources, it's like a stroke of luck. Like if you get pregnant, there's a chance that the mom might not make it. The next kind of disorder or condition that you might have is what they call shock. And there's a different kind of shock. This is very interesting. A lot of people that end up dying because of issues of COVID or issues of allergies is because of shock. So the first one is called circulatory shock. This is whenever there is a blockage or inadequate flow of blood and delivery of oxygen to tissue. So this is where you cut it off. And sometimes they call it ischemic attacks. And because you're not allowing oxygen to get to those tissues, you basically can lead to death, right? So this is where tissues die off. And then if the wrong kind of tissues that you need to survive die off, then you will not be able to make it. So in terms of shock, how do you detect this? This is very hard to look at, and that's why when you are in the hospital and you're being monitored, you have to look at all of these different vitals, right? So number one, your blood pressure. Early signs of shock include when you have a sudden drop of pressure. So now your pressure begins to be very weak, and then you have a gigantic jump in increased diastolic pressure, which is the lower number of the two, right? So 120 over 80, the 80 is diastolic pressure. When this number goes high and your pulse goes down, that's the first sign. And so that's why when you are monitoring a patient and you're looking at the EKG or you're checking their numbers, you don't just walk in and do your rounds, right? As a nurse, you actually check up on their signs to see if there are early signs of shock. Another one is if you have changes in urine. So if there's an increase in osmolarity, which is meaning that there's a lot of stuff in your urine, and then you also have a drop in sodium amount, that could also be another sign. And then the third one is also the change in pH. So as a result of an alkalinic condition where your body becomes extremely basic, you begin to hyperventilate. And the reason why you hyperventilate is because you're trying to get rid of some of the bicarbonate and CO2. And so you begin to hyperventilate, and when you see a patient hyperventilating on a bed, that's also another sign. And then the last one is if you see changes to their skin, right? So their skin becomes very dry. Again, these are early signs, and that's why these are things that you would look out for when you do if you're a good nurse, if you're a good doctor, you look for these signs, right? You don't just brush things off. And then the second chart here is the late signs. These are the ones where once you see them, you're pretty much in a condition of shock already. So decreased volume of urine, consistent decrease of volume. You have an extreme drop in systolic pressure. So what happens is the force of your heart pushing the blood out has dropped down so much. And then you have this decreased acidosis. Basically, your body has not have enough protons and acid. And then your skin becomes extremely clammy and cloudy. All right, so these are all extreme symptoms to look for. When you think about cardiovascular reflexes, your heart begins to compensate, right? And this is where it gets really interesting. So there is these mechanisms in our body where you're trying to survive. And this is why if you ever think about biology and evolution of our system, our bodies, we're designed to survive, right? Everything we do is to try to survive a little longer and to be more efficient. That's the theme of biology. And when you go into shock, the first thing that happens to your heart is your sympathetic division begins to kick in. So you try to increase your heart rate very temporarily to produce an increased stroke volume, increased contractility. So you're able to push more blood and to survive, right? So your body is in a survival mode. Your heart tries to reboot itself real quickly. But if it doesn't, if it doesn't have enough fluid, then eventually it can't do anything. The digestive system begins to decrease blood flow because you're not allowing more blood to get to your digestive system. You allow more of the blood to go to the right places you need. And then your kidneys also will start decreasing urine because you want to hold on to any fluid you have. And the last thing you want is to pee more, right? Because if you don't have enough fluid already, the last thing you want is to urinate and lose more fluid. And so what happens is you're going to have this increased boost in aldosterone and ADH. So those two hormones, which you are well familiar with, one is made in the posterior pituitary, ADH, and aldosterone made by the adrenal gland. it's going to then elevate, and as a result of that, retain water and retain sodium, right? So you have these two hormones that are working together on the same side. Another kind of shock you might hear about is what they call hypovolemic. This is where you have blood loss. So you go through trauma, let's say you go into a car accident or you have a gunshot wound and you have blood juicing out of your body and you're losing all that fluid of blood, or even burn victims, right? You're going through hypovolemic shock. This is when you have a drop in cardiac output because you don't have enough blood. And this is where if you donate blood, there's gigantic value, right? That's why you always hear about the need for donation of blood, is that when you have people that go through these kind of injuries, unfortunately car accidents and gunshot wounds, you need blood. You need to put blood in the person to get them to survive. And then what happens is that when the blood gets diverted to the heart and brain, other organs basically get screwed over, right? They don't get the nutrients and they start dying off. And because of that, you might have other organs that become problematic down the road. But the compensations are basically a way to elevate your pressure when you need it, raise your heart rate, raise your peripheral resistance, and so that you're able to survive that blood loss. Another kind that you might hear about in hospitals when you get infections is what they call septic shock. This is oftentimes onset of viruses and bacteria that produces chemicals that can cause sepsis or infection. And this is when you have an extremely low blood pressure, and this is because of the immune response. Your immune system begins to kick in, and certain kinds of bacteria can generate endotoxins that will create problems and allow you to begin to dilate blood vessel. And the dilation is because of nitric oxide. So NO is nitric oxide, that chemical that dilates your blood vessels. And because of that, you end up having such a low blood volume, and your blood vessels are so wide open that not enough blood is getting from A to B, right? So imagine you have this gigantic freeway, but you have this one car, but you're supposed to fill up the freeway, right? You have 5 lanes to drive, and you should have 5 cars driving at each time, but you only have one vehicle. So you're having this gigantic blood vessel and not enough blood to flow, and you have a very high death rate, which is mortality rate is 50 to 70%. And this is usually due to allergy. That's why allergy is a big deal. And if there's one medical exemption to COVID, which I believe what they're granting right now is if you are allergic to the PEG, which is one component of that lipid nanomonomer that is used to deliver the virus, the mRNA into the cell. And as a result of that, this can cause you to have this gigantic flux of histamine, and resulting in extreme vasodilation that then leads to that shock situation, which you said. And then the worst case scenario is you have cardiac failure, and that's what causes death, right? So that's why when you see people that have allergies and they have an allergic attack, let's say a bee sting, and you don't have an EpiPen handy, then that will cause you to then choke up, and because of this overwhelming cardiogenic shock, then you don't survive. So the last kind of condition you might hear about is CHF. CHF is one that is when the cardiac output is not able to balance with the amount of blood flow. So there's a mismatch. So the amount of blood flow in and out the body doesn't match out with how much the body needs. And the root causes of CHF is some examples like valve disorders that we talked about last week, when you have a murmur and then the valves are too stiff or they're too soft. And this can also be caused by heart attacks, right, or any kind of congenital genetic disorders where you have an opening in the heart, or hypertension. But anyways, all of this is because of the fact that you have some distortion of our cardiac output and the blood flow. And because of this, there are 2 general categories of heart failure. The left side heart failure, which is the left side chamber, is usually a result of a raise in arterial pressure that is produced in the lungs. So just imagine this, you have a congestion in the lungs, and so it affects the amount of blood going back into your left side of the heart, right? And so therefore, the left side of your heart will fail. And so just imagine you had a car accident at like 180, and then the junction between 180 and 41, then that means if you block off 180, then the people that where it clears up and where the issue is going to be and changes in the traffic is going to be on the 180, on the 41, because that's where a block begins, right? So left side heart failure is always a lung problem, and the right side heart failure is always a body problem, what they call systemic blockage. So that means your liver or your kidney. So just one thing to always remember, if you can take something away from today's talk, is whenever you see a left side congenital heart failure, you know it's the lungs that are messing up. Something is wrong in the lungs. And that's why in COVID cases, if you were to have very bad COVID and a lot of fluid or pneumonia that eventually causes death, it's probably going to be pneumonia blocking your lungs, fluid accumulation in your lungs, causing a congestion, causing edema, and then eventually causing your left side of the heart to not work, and therefore you die, right? So it's like you get COVID, COVID causes damage to your lungs, lungs causes edema, edema causes left side heart failure, and then the patient dies. So that's the chain of story of what happened. So what really caused the death? It's COVID that began the story, so that's why they would bring it the cause of death. And then the right side heart failure is when you have a body problem. So let's say you have a liver problem or GI problem, then your right side of your heart can fail. All right, so that's how this works. Very interesting, but that is a quick way to assess where it begins and where it comes from. And then there's obviously a lot of compensation, right? Just like we said before in earlier cases, similar to hypovolemic shock, the sympathetic division will try to boost up the heart rate, your adrenaline kicks in, and that's why EpiPens work. So if you ever heard about this device called EpiPen, this is a little syringe that you can carry around, and if you get a bee sting or get an allergy, you just jab into your thigh. What that is it's just a shot of adrenaline, right? So when you get a shock, your natural way to fight this is to release adrenaline. So instead of waiting for your body to make adrenaline, you just inject it exogenously. And it's something good to have if you know somebody that's allergic. You know, it's safe. And there was a big scandal not too long ago where they were trying to jack up the price of EpiPens, and they were trying to dominate, and that got into like a court. I forgot what I think the CEO of that company ended up getting some kind of fine or jail time, but he made the EpiPen cost like $400 a jab, and that's ridiculous. It's like basically patenting adrenaline, right? Imagine somebody owning the rights to adrenaline. We all have adrenaline, and we all need it sometime, right? Imagine somebody had the ownership to that thing. It's not right? Because it's something natural. So some of the general compensations include when you have extremely low cardiac output, right? You're going to be able to want to compensate for that. Elevation of blood volume, dilation, and hypertrophy of ventricles, and also when you overload the heart. So that's why when you gain weight really quickly, you strain the heart. So that's why it's never good to just gain too much weight too quickly, and then you also don't want to lose too much weight too quickly as well. Your body needs to compensate, your heart needs to adjust as well. Okay? The general treatments of CHF, if you go to a hospital and you have right side or left side heart failure, there are some drugs you can use. ACE inhibitors are always good, which is the one that blocks the ACE enzymes. ARBs are pretty good. These are the aldosterone receptor blockers, and these guys can block the receptor, beta adrenergic receptor blockers, beta blockers. And then there's one drug in particular which is pretty cool. So there's a drug that's called digitalis. This is made from dioxin, which is a plant-based chemical. And these are all derived from plants, by the way. So that's why if you ever think about drugs and chemicals in the plant, don't ever look down on plants. Most of the drugs we take are plant and herbal based. The digitalis what it'll do is when you take that drug, it will, in a short term, boost up the heart cardiac contractility rate, which is crazy. So it's an herb that can do that. And then another one that is vasodilator is nitroglycerin. It's a patch where you put on, and it helps you open up the air, the blood flow. So you never ever combine these. Rarely, some of these are better suited for certain ethnicities, and I think I talked about this last time, where at a genetic level, different ethnicities can do better when they have CHF on different kinds of drugs. So if your patient is a certain ethnicity, the protocol might be different than another person. All right, so that's how diverse these drugs can be. And of course, diuretics are pretty generic. They're just used to help you increase fluid loss and urine loss. All right, so let me stop there. I hope that interests you a little bit with the disorders, diseases, and that's just a little glimpse on cardiovascular disorders. Any